Good morning, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and I'm just going to record one of the role plays for you. And this is one of the role plays we are doing today. So in this, it says that patient is 51-year-old, had a lesion removed following the diagnosis of squamous cell carcinoma. He was overexposed to sun in his teens. You have come to remove the stitches of that person. So basically, you have come after the operation to remove the stitches. Now, the first reason you have come to the patient, you have come to remove the stitches and the patient is in clinic. Confirm the reason for the visit, removal of stitches. So basically, this is a point that can make you little concerned. That point says confirm the reason for visit. So you say, good morning, my name is this, I am a nurse over here. I have come here. That is the reason. I have come here to remove your stitches and to clean your wound and to redress. So while I do that, जब तक मैं ये कर रही हूँ, while I do that, I would like to ask you for any concerns. Then patient will say, nurse, I'm really worried. Our doctor told me about squamous cell carcinoma, but somehow I want again to know everything about it. What's happening? What can be done? What are the treatment? Okay, don't worry. Let me give you the information about the squamous cell carcinoma. It is a type of a skin cancer, but there are various treatment options which are available for the surgery. Like in your case also, the surgery has been done and the lesion has been removed. So there is nothing to worry. I would like to reassure you about your surgery as well, that lesion has been removed and cancer is unlikely to be spread. So you need to be really calm at the moment, and I reassure you there is nothing to worry in your case as the lesion has already been removed. Also, I would like to stress on the importance of skin monitoring, that you need to check for any new signs or spots, and also regular GP visits. You should go for the checkups regularly to general practitioner so that he can find out if there is any new lesion, or regular monitoring is required by yourself as well as from the GP. So that is how you can cover these simple points. Again, good morning, my name is this, I am a nurse over here, and as you were diagnosed with squamous cell carcinoma and the lesion has been removed, so I have come here for the removal of the stitches and to clean your wound and to redress it. Also, while I do that, I would like to ask you if you are having any concerns. Well, yes, nurse, I am having this and that. Okay, don't worry. Let me give you the information about the squamous cell carcinoma. As you know, it is a type of a skin cancer, and there are various treatment options available for it, like surgery. In your case, also, the lesion has been removed, and now I want to reassure you that your surgery has been successful, lesion has been removed, and cancer is unlikely to spread. So you are absolutely out of danger and there is nothing to worry. But nurse, I'm really kind of worried that what will happen in the future. See, I understand that it must be terrifying or it must be little uncomfortable for you. Terrifying is not a good word. Patient ko डराना नहीं है. So I understand that it is little uncomfortable for you, but I would like to tell you that that is why it is important to monitor your skin on regular intervals. So you should have a regular checkup with GP. You should come up for the follow-up visit. And also we need to check continuously for any new spots or the changing spots around your skin. So are you getting my point? Yes, nurse, I'm getting my point. I am getting your point. Okay, that's great. Resist the request for information about further surgery. Advise patient to speak with doctor. Find out about the patient's habits when in the sun. Now, this is the point which you wanted to ask. कि अगर patient आपको तंग करता है तो that is what you will say. See, I would like to tell you that there is no requirement of further surgery. Also, if you are still doubtful about it, then I will fix your appointment with the doctor and you can speak to the doctor. So, do you think I should fix your appointment with the doctor? Yes, nurse. Okay, then great. That I will do. I'm fixing your appointment with the doctor. He will explain you and he will confirm you that there is no requirement of further surgery. Also, I would like to discuss about various habits while being in the sun. That always use the sunscreen lotion when I going out in the sun, and also use the hat. Are you getting my point? Are you following me? Yes, nurse, I am following you. Okay. Now I want to confirm that some damage is historical, and now you need to continue covering up your skin to prevent further damage. So what I mean by this statement is that there is some damage that has already been done. So, but further damage can be avoided. For that, that is why I have told you about the sunscreen, the hat, and also most important is to cover up your skin to prevent the further damage. Am I comprehensive? Yes, nurse. Okay. Also, I would like to tell you about the post-surgery wound management, that if there is any pain or any discharge, you need to inform us about that. Okay. Okay, nurse. Okay. So now I'm removing your stitches as the wound healing is good and it has been assessed by, so that doctor can assess it, and typically it is removed after 7 to 14 days. So ये basically removal of stitches के बारे में कह रही है, that it has already been some days. So now I am removing your stitches and also doctor will assess your wound, and typically it takes around 7 to 14 days. So in this patient के case में भी 7 to 14 days हो चुके होंगे. Now after removal this, you need to keep the wound clean and keep it dry and keep it covered. So patient consent to have stitches removed. So now may I remove your stitches? Patient कहेगा yes. Okay, thanks for giving me consent for removal of the stitches. Thank you. बस then you continue. इस केस में हाईलाइट करने की जरूरत नहीं है. अगर आप हाईलाइट करना चाहते हो, so ऐसे कह सकते हो, before removing the stitches, I would still like to highlight the key points of our conversation, that there is nothing to worry. There are some damages which have already been done, but there is nothing to worry. We can prevent the further damage by using this, like sunscreen, screen, and other solutions which I have told you. So here is also a leaflet that I will leave here, that I will give you before you leave the clinic, and you need to take this pamphlet at home and you can read this leaflet, and it also has our number. If you feel anxious about anything, you can call us. Okay. Okay, now please allow me to remove the stitches. Okay, nurse, thank you. That's it. हर रोल प्ले के हिसाब से चलना है, इमेजिन करना है अपने आप को. सो अगेन अब मुझे इस टास्क को बोलना है अच्छे से. आई वुड, अब देखो मेरे को आपको सिखाना है, फिर भी मुझे बोलने में कोई प्रॉब्लम नहीं है, तो आपको तो कम से कम 5 बार प्रैक्टिस करनी चाहिए. 5 बार कुछ नहीं जाता, कर लो. एक बार दोबारा बोलो. Good morning, my name is Dice. I am a nurse over here. So I would like to confirm the reason of my visit, that I have come here to remove your stitches and to clean your wound and to redress it. So may I do that? Yes, nurse, you may do that, but I am having some concerns. Sure, I would like to resolve your concerns. So could you please explain me about your concerns? Well, nurse, I'm really worried about this carcinoma, about its further management, and what will happen, lesion. I don't know. I want to know everything. Okay, so let me explain you all the points one by one. First of all, I would like to give you the information about the squamous cell carcinoma. It is a type of a skin cancer, and for this treatment, there are various treatment options which are available, like surgery. Like in your case, lesion has already been removed by the help of surgery, so you will be fine and there is nothing to worry. But nurse, I'm really concerned that how would I further manage? Well, I want to reassure you that your surgery has been successful and lesion has been removed and your cancer is unlikely to spread. So there is nothing to worry. But nurse, I don't know what to do next. See, now what is important is to come for your follow-up visit and for the regular checkups by the GP. And also you should keep a check on your skin by yourself, that you should regularly monitor your skin for any changes, for the new spots or the changing spots. Are you getting my point? Well, yes, nurse. Okay. But nurse, do you think I require further surgery? Well, not at all. At the moment, you do not require any further surgery. But nurse, I'm really concerned. I feel maybe I require further surgery. For that, I would like to advise you that you should speak with the doctor. If you allow me, I can fix your appointment with the doctor. He will come soon and will also, tell you about that there are no further surgeries required, so that you can feel satisfied, and he will provide you counseling as well. So should I do that for you? Yes, nurse. Okay, then I'm fixing your appointment with the doctor, and maybe doctor will come here soon, or before you leave, I will try to fix it today only. If not today, then I will call you up for the follow-up visit. Doctor will see and will counsel you regarding further surgery. Is it okay? Okay. Now I would like to give you instructions about the habits. As you know that it has already happened due to the sun, so now it is very important for you to use the sunscreen lotions and to wear hat whenever you go out in the sun. And also I would like to say that some damage has already happened in your case, but I would like to advise you to continue covering up in the sun to prevent further damage. So you can prevent the further damage by avoiding the sun. Are you getting my point? Okay. And now I would like to tell you about how to manage your wound after surgery. So you have to take care of any pain happening or any discharge happening from your wound or from your skin. So, are you getting my point? Yes, nurse. Okay, that's great. Now we want to remove the stitches because your wound healing is well and it has already been assessed by the doctor. And normally it takes around 7 to 14 days. And in your case, it has already been 7 to 14 days. So now it is the time for the removal of the stitches. And I would like to take your consent that should I remove the stitches now? Well, okay, nurse. Okay, thank you very much for giving me consent. And I would like to highlight the key points that there is nothing to worry at all. Your cancer, your cancellation has been removed, and your cancer is unlikely to spread. You just need to follow the measures which I have told you. Here is the leaflet that contains these measures, and if you follow these measures, you will be absolutely fine. All right. So, can I remove the stitches now? Yes, nurse. Okay, thank you very much. So don't speak anything that has not been given in the role play. Try to restrict yourself or refrain yourself from speaking something that is not given in the role play. And again, in OET, these backgrounds, like my room, like my facial gestures, like my notes, they do not matter because it's only the audio recording that will go. So keep practicing. The best way to practice speaking, OET speaking, is to record, listen to my video till the end. First thing, record your voice, audio voice. Listen to it, again record. Listen to it. Now the recording that you will do, you will definitely find some improvement. And that is what we are after. Because अगर आप देख रहे हो information तो we are reading. हम OET speaking के main components क्या है? Don't worry, I am here to help you. I assure you for the best services. I assure you this. Please don't worry. Please try and cooperate. We all are here to help you. These are the components which keep on repeating. So practice these components of OET speaking. Rest information is already given to you, so there is nothing to worry. This is Dr. Bhupesh from Dr. BKM Institute. Subscribe our channel if you have not. And our contact number is 76967 34256. Thank you.